Much. Now, a new strain of the Mpox virus spreading quickly along the eastern border of the Democratic Republic of Congo is incredibly worrying, according to health officials monitoring its spread. The virus, which can cause lesions across the whole body, is making some people very ill and can be deadly. The current outbreak has been driven by sexual transmission, but there is evidence also that this strain can be passed through close skin-to-skin contact. To tell us more, we are joined now by Trudie, who is Professor of Global Health Research, Head of the Global Health Network, and Senior Research Scientist in Tropical Medicine at Nutfield Department of Medicine here in the UK. And from the Rwandan capital, Kigali, we are joined by Claude Udahemuka, who is a researcher at the University of Rwanda. He's been working on the ground in the DRC to tackle the outbreak. Good morning to both of you and welcome to Newsday. First to you, Professor Lang. Tell us more about this new strain.
Oh, good morning and thank you for having us. Well, this has been emerging for a few months on this very vulnerable border area. And it came to our attention because it appears to be quite different from the normal Mpox that we've seen circulate in Africa for many decades. This time we're seeing, rather than it being associated with bushmeat in the household, we're seeing, as you very accurately put, this person-to-person transmission, but mainly driven by sexual contact. The severity of the disease seems different, and we're very worried about the different routes of transmission and also the difference in severity of disease.
And that severity, if you may now come in, please, Jean-Claude, tell us about what you have seen in the field, on the ground, in the east of the DRC, where you've been doing some research.
Well, thank you very much, and good morning, and thank you for having us this morning. It was not easy because the outbreak started in a remote area, in a remote city in South Kivu. It's a mining city, and the roads there, reaching there is not easy. But and the people are sometimes not they're in poor conditions. So the outbreak started in bars, and it started in a specific group of sex worker ladies who started showing symptoms of Mpox, but lesions were more severe. But we still have so many unknowns. We have done many things, but many things are still to be investigated. We now know that there is a mutation compared to other clade 1 that used to circulate in DRC, but there are so many other things that we still have to investigate.
Jean-Claude, do we know whether this has spread beyond DRC's borders?
It has spread outside of the initial city of Kamituga, and it has now reported at the border, at the cities of DRC that are at the border with Burundi, Rwanda, and Uganda. We are still waiting for official announcement if the neighboring countries of DRC in the east and DRC can make an official statement, but so far we don't know.
But would you guess that it's likely that it has spread?
There's a high movement of people crossing borders daily, like everywhere in Africa, and it's if measures are not taken, there's a high possibility.
And what are those measures that are being taken then to prevent this from spreading further?
What should be done, I think, is to first of all sensitizing people about the disease, but also detecting and at the border, at the point of entries in different countries. And this is what we are trying to do with Professor Lang. We are setting up studies at the borders to detect the disease.
Professor Lang, how easy is it to monitor something like this?
Yeah, thank you. Well, this is the challenge, really, and I've been, I got to know this disease because I was in Rwanda with the team back in January when this came to light, and I've been right up to the border that Jean-Claude has talked about. It's an incredibly challenging area to work. There's no doubt about it, and to me, it reminds me very much of when we worked on outbreaks like Zika and Ebola, and working with these incredible, dedicated healthcare workers in this region and trying to put in place that research infrastructure where there hasn't been any before is very, very difficult. There is incredible collaboration across these borders, and I think that's a really important point to note. We've got all the agencies are working together because everybody wants to work to detect and then prevent this very concerning new outbreak. So it is incredibly challenging, but we do need this international collaboration and to put, the containing risk and health above everything else in that region.
And in a world where COVID has shaped so many things over the last few years, and in a region, I suppose, where Ebola outbreaks are very common, what are the scale of concerns here? Is this something that should be worrying people around the world? Is this a very localized problem?
No, I'm sure it isn't. And I think it's really important to be just watch this very closely. I think the interesting point is that the cases we've seen, so over 700 documented cases in Kamituga, these are the severe cases that are presented in the hospital. It takes quite a while for the rash to be seen in these cases, and we still don't know, as Jean-Claude said, we don't know how infectious this is before the rash presents. And of course, sometimes the rash isn't visible, or we don't know what mild disease looks like and how infectious people are. And so there's a very high likelihood of people travelling between these countries, but also getting on planes. And so we do need to be very aware, put as much international support into this region as we can, because obviously the immediate priority are these communities, but there's no reason why this and it isn't already crossing borders, as we've seen in South Africa.
Professor Trudie Lang and Jean-Claude Udahemuka there talking about the spread and what health officials across the world have called incredibly worrying of the spread of the Mpox, especially across the border of the Democratic Republic of Congo in the east. This is News Day on the BBC World Service. For myself, James, Isaac, Mariko, and the rest of the team, thank you so much for your company.
Bye-bye.